The mission of the Outer Banks Hospital is to enhance the quality of life for the residents and visitors of Dare County and the surrounding region by promoting wellness and providing the highest quality healthcare services. Thank you for allowing us to care for you and to coach you toward wellness.
I was diagnosed with melanoma in January of 2013, and shortly after my surgery I noticed some swelling in my leg, and when I went back to my doctor, he referred me to therapist at the Outer Banks Hospital.
Lymphedema is the buildup of lymph fluid in the body that results in swelling of your arm or your leg. You can get lymphedema after you've had the removal of lymph nodes or radiation to lymph nodes in the areas of the armpit or the groin. Early diagnosis and treatment are the keys to controlling the symptoms of lymphedema.
Lymphedema is something that you have to figure out. Everybody's lymphedema is different, and you have to figure out what works for you best, what compression garments work best for you, and how you can manage your lifestyle with lymphedema.
Before any signs of swelling may be seen, you may have sensations of achiness, heaviness, numbness or tingling in your arm, or your clothes may feel uncomfortable to you. Sometimes when you first notice signs of lymphedema, you'll have some mild swelling in the day that you just begin to notice. You may no longer see the outlines of your knuckles or the veins around your wrist. If you start to notice any of these early signs and symptoms of lymphedema, notify your physician immediately and ask for a referral to see your certified lymphedema therapist as soon as possible.
Every patient who is at risk for lymphedema could benefit from a proper fitting of a compression garment by a certified lymphedema therapist. And there are a few things that you can do to decrease your risk of lymphedema, as simple as avoiding a sunburn, avoiding extremes of hot and cold, avoiding any nicks or injuries to the extremity. It is important to keep your arm and leg protected, such as wearing sunscreen, avoiding nicks and scrapes, and insect bites. If you do cut, burn, or injure your skin, tend to it immediately and look for signs of infection. It is important to wear your compression garment when you travel. You also want to avoid extremes of hot or cold. Exercise is an important part of therapy, and we want you to exercise and we want you to get back to those things that you enjoy. It's important to gradually build up your tolerance and your endurance and monitor signs and symptoms of lymphedema.
Lymphedema is not something that people talk about all the time. Everybody knows what cancer is, but not everybody knows what lymphedema is. And so it's something that you definitely want to be able to have somebody to guide you through that process. Therapists here are very helpful and very knowledgeable about how to treat lymphedema and manage those symptoms.
I had my last surgery 6 months ago, and as of today I am not showing any signs of lymphedema. There's so much information to digest after a cancer diagnosis that lymphedema may not be at the top of the list, but it definitely is something that you need to be aware of. I am grateful for that information. I don't want lymphedema, and I'm hoping that I can prevent it with all the tools that I learned here.
If you feel like you're at risk for lymphedema, it is really important to talk to your physician and get a referral to come and speak with a certified lymphedema therapist where we can educate you on some simple techniques to manage your signs and symptoms. The Outer Banks Hospital has 2 certified lymphedema therapists who can assist you with your needs.